Dr. Li Han and Dr. Li Tong-Hung to have me today. I'm Winson I'm plastic surgeon from Hong Kong. As Dr. Li Han also mentioned, I'm now the president of the Hong Kong Association of Cosmetic Surgery, which is a sister society of Winson. So it's a great pleasure to be back again. So my topic today, which has been published recently in the clinic in plastic surgery. And this is my disclaimer. For those who know me, I'm the international key opinion leader and trainer for MERS as well as Teoxin. So let's kick off with Asians. If you look at these typical Asians, what is peculiar with Asian face is we have a very flat, square, short face. And it is wide, it is masculine, it is aesthetically undesirable. So treating the patient starting from the mid-face, which is the center of the whole face, a youthful representative of a female should have a well-projected cheek as well as malar bone. So you can see from the profile view, this is a typical Asian face, where the mid-face is a little bit concave. So this is aesthetically undesirable. So this injection point starting from the lateral to medial, because by injecting laterally, you will improve area which is beside the injection points. So it is a 3 to 4 to 5 points. There's no definite points. It depends on patient's situations, usually around 3 to 5. And it is a microbolus injection. Microbolus injection means less than 0.1 cc per site, which will give you more natural result and more safe. Even if it is intravascular, the amount will be small. As mentioned before, you should inject slowly under low pressure to decrease the intravascular accidents. I like to use needle over this area, although cannula show less intravascular events. Needle, I think most of the Asian doctors will like to use needle for the mid-face because it's more precise and you have better tactile sensation. So you give you more controllable, predictable result. So this is how I do my cheek. So I'm going to skip that. Of course, you can use cannula. Right. Now, for most of the time, for Asians, for the mid-face, this is a structural problem. Structural means developmental, which is inside our gene, which is in the deep layer. So the injection is usually into the layer 5 or layer 4, which is the deep facial fat pad or the superior osteo area. Injecting in this area should use a product which is hard, which has high G prime to give you the projection. So most of the time, it can be done with needle. You can use a cannula. It's up to you. Using a cannula, to me, with less tactile control, less precise control. But cannula has definitely far less intravascular event. After all, the intravascular event in fillers injections, I'm talking about hyaluronic acid-based fillers, is less than 1 in 5,000 syringes per case. So this is a typical Asians. You can see the under eye shadow. Some people will call it teardrop. I will call it pseudo teardrop. It's not the real teardrop. It is because of the poor anterior projection of the mid cheek or the middle cheek. So the injection strategy is I start from one point, which is just lateral to the lateral canthus, injecting to support the zygomaticus cutaneous ligament. By injecting here, you will project the malar bone, and also by giving support to the zygomatic cutaneous ligament, you will improve the nasolabial fold, the jawline, and also improve the definition of the jawline as well. And then you follow by another injection just at the lateral canthus, aiming at the SOOF, S-O-O-F. So by injecting into this area, you give support to the lateral canthus, as well as you give support to the orbicularis retineal ligament. You will change the eye shape into a more almond shape. Not to mention, you will improve the lid-cheek junction depression. And the last one injection will be the reef beam deformity, which is the junction of the teardrop as well as and the lychee junction. So this is a very common area. This is called the V deformity. So you inject the product into the medial suit, you improve the tear trough or the tear trough immediately. So only after 0.5 cc each side, you can see the changes. By also, when you inject into the anterior cheek, you can narrow down the mid-face. As I mentioned before, Asians has a wide mid-face. They want smaller face, well-projected face, and a face with better proportion. So in older patient, more mature patient, you can use these 3 to 5 points injections according to patient's condition. You can improve the result immediately. You can also see the improvement in the sclera show, which is a senile appearance. In more severe patients where you have almost concave bimaxillary protrusions, this is a candidate for maxillofacial surgery. So apart from surgery, surgery, what you can do is project the anterior features, the medial features, the nose, the upper lip, and the buttress, and the piriform fossa. Without doing surgery, you can see the improvement immediately. No downtime, and the patient avoiding the surgery. So this is what we can do. And most of the time, it's a panfacial treatment, just like the fat graft. So by injecting into the temporal area, into the anterior cheek, into the chin, a bit to the nose. She's a plastic surgeon from China. So I did her on a live demo. Now what I want you to see is the change in the eye shape. Okay, so it is in change from the round eye into a more almond shape, which is more youthful and more feminine and more attractive. So this is the picture taken immediately after the injections. No downtime, no bruising. You have to manage your injection technique correctly. So this is a central features enhancement. That is a must-learn technique in treating Asian patients because we have a poorly projected medial features. And for the Caucasians, their injections mainly on the outline. It's different from us. The face is much smaller. So by injecting into the nose, the forehead, and the chin, and the medial cheek, the patient looks more feminine, more balanced, and more attractive. All the patients come for you either for surgery, minimal invasive surgery, skin care, or fillers, or toxins. They come for not just the medication, they want to be more attractive. That is the hidden agenda. So after all, without harming your patient, you need to make them look more attractive. A typical Asian patient, square face, look angry, look masculine. She's only 26 years old. So what you're going to do is the contouring. Instead of square face, you change to the more oval face, which is a universal standard of beauty that applied across all nations for female. Okay? So it's a representative of femininity as well as youthfulness. 7 years down the road, she still looks attractive than before. It's all about balance, interior projections, removing the shadow, and improve the facial features proportion. From a square face into a more oval face. Because when you age, the oval face will become more square. So if for the middle-aged lady, 42 years old, we're doing the same thing by combination therapies. Not just filler, but combining with toxin, with high NTP-based devices. Without surgery, you can see she looks more balanced. And more important, look at the chin muscle. Look at the chin mentalis muscle become more relaxed. And I'll talk about the advanced theory of fillers, about the malmoderations. She's 32 years old, coming in because of the eye bag and tired-looking eyes. So are you going to feel it? I think she got to abandon tissues. The major problem is tissue repositioning. Without filler, without toxin, just a mid-cheek flap. Flatlet to the mid-cheek. You can see immediately after the procedure, you still can see the puncture hole. no bruise, no nothing. You can see the disappearance of the eye bag, the tear chalk. But one most important changes you should not miss is see the double fold. The eye double fold. There's no forehead lift. There's only chin lift. Why there's double fold improvement in her? Okay? We commonly see this kind of phenomenon. And we commonly see also in other areas as well. So let's go back to basic. When we inject fillers, we think we are giving structural support, aren't we? Right? Structures. You need bony projections. You need to replace the bony resorptions or underdevelopment of the bone. You give fillers to deep layer, which is the 4th, 5th, as I mentioned, layers. You give the structural support. You give fillers. For the functional one, dynamic wrinkles and so on, you use neuromodulators or neurotoxin to moderate the facial muscle functions. But is that true? Structural support only give you static support? Let's give some example. She had a very poor dentation. She looks like that. After fixing her teeth, she became the Miss Thailand. It's not about the appearance. Look at the smile, the change in smile. It's a functional change, not just aesthetic. Ronaldo, everybody know him. He's the Mr. World Football, Mr. Football World Cup man. All right, so if look at him before he seek help from us. Look at the teeth, look at the smile, gummy smile and everything. It's all teeth dentation or bony changes can modify muscle behavior. And mind you, the face is highly mobile and functional area, mainly over the anterior face, not the posterior face. Posterior face should be fixed to support the function of the anterior face. If the posterior face is also mobile, when you talk, your face will be rippled. Okay? Everything happens for the reason. Bear this in mind when you do the injection. It's not as simple as you think. And then about the different layers of our face, we have 5 layers from the skin all the way down to the bone. The superficial 3 layers, which is the skin, subcutaneous fat, or the superficial fat pack, and the smart layer is the highly mobile functional layer. As I mentioned before, the deep layers, the 4th and the 5th, is the static layers. You give very, very static solid support for the superficial layers to glide on. One of the aging changes that you see is the muscle imbalance. Why is happened? Is it because of the muscle aging or more than that? Because when you age, there's a bony resorptions, and that is atrophy of the deep fat pad. What happens is you lose aesthetic support to the superficial functioning layers. So that will contribute to the imbalance you see in aging process. So, ladies and gentlemen, I'm going to bring you from fillers to structural support and the functional perspective from the fillers. Once again, 66 years old, Michi look at the elevation of the eyebrow. There's no brow elevation. As I mentioned before, why this happened? In her and the one 32 years old with improvement in the double eyelid, eye bag, and the tear chart. I can tell you the philosophy now, or the thinking now is, when you reposition the tissue, you reposition the soup layer, which is the layer behind the orbicularis oculi muscle. And you give the support to the orbicularis oculi muscle. The muscle relax. Remember, orbicularis oculi muscle, the eye muscle, is a sphincter. It's the elevator of the cheek and also the depressor of the eyebrows. So when the muscle relaxes, the eyebrow will raise. Okay? So that is the brow elevation because the support, structural support, given to the orbicularis oculi muscle. Look at this young lady's chin. After fillers into the chin, and the muscle relax, and therefore the disappearance or the improvement in this copperstone deformation. There's pimples, those dimples disappear. There's no toxin here. There's no neurotoxin here. There's pure fillers. So this is structural support that will modify the muscle function, what we call the malmodulations. It appears in all the structures, and the paper we published a while ago together with BEAUTYFUL and Stephen Liu. You can see the change in the chin muscle, mentalis again. It becomes smooth out after structural support. So this is, as I mentioned, is malmodulations effect after filler. Structural support change the muscle tone and balance, and also the muscle excursion when they function. So it's not just a new idea. We've been seeing these kind of phenomena every now and then. More youthful look. Look at this gummy smile. Fillers into the piriform fossa, giving the support to the zygomaticus minor, levator nasi superioris, levator nasi superioris, ulnar nasi 3 muscles. After they relax, the gummy smile disappears. There's no Botox. There's no neurotoxin here. It's all about malmodulations. And also see the changes in facial animations. Patient has a filler into the chin and the middle cheek only. Look at the way how she smiles. From an asymmetrical smile to a more balanced smile. Look at the way how she kisses. There's less eversion of the lower lips. And that is one of my model long while ago. At that time, I didn't know the functional modification. Look at the way. When she smiles, there's less eversion of the lower lip, which is more youthful and attractive. Look at her kiss, less eversion. And that been published in various papers by different authors. We all see that. Okay? The world is moving fast. On the other hand, if you overfill your patients, you jeopardize the muscle function as well. How many times your patient with overfilled cheek tell you, I cannot move my face, I cannot smile anymore? It's because the overfilling will destroy or disrupt the function of your facial muscle. It gives you the mechanical blockage. So you fill up those space. The space here, God gives us this space because when we smile, the soft tissue has the room to move up. If you fill up all this space, there's no room for the soft tissue to move up when you try to smile, when you try to animate. So you become a stiff face. And even worse, it will cause permanent structural or anatomical damage with this ridiculous overfilled face. Don't do that. And sometimes you inject in the nasolabial fold, you end up with this unnatural stiffness. And this is because you use the wrong product. You use a very hard product into the superficial layer. Superficial layer, you should use a dynamic fillers, which is supposedly softer, is more resilient to shearing force. So, we become a more advanced fillers to give you the natural result. So normal to me will apply to beautification and rejuvenation. Beautification for youthful people, better version of me. Rejuvenation, patient wants a younger version of me. Remember that me. So this is a patient after nothing but micro-focused ultrasound. The training is our therapy. Nothing. Skin quality improved in tear troughs and nasolabial fold. With fillers only, you give the structural support to the cheek, and then to the chin, and then to the nasolabial fold, the prejowl sulcus, and the superficial layer, you brush up into jawline and the tear trough area line. Patient with severe scar, any scar, and severe nasolabial fold, and 42 years old patients after fillers into the tear trough, lychee junction, anterior cheek, zygomatic arch, mandibular angles, all together 6 cc for the whole face in 2 sessions, as well as micro-mucus ultrasound. So you end up something from there to here. No surgery, skin quality improvement, natural result, more balanced face. Use advanced filler, give the seamless tissue integration, resilient to repeated movement, give you a predictable, reproducible, and natural result. They have an optimal rheology for in different layers of the tissues, and they give you a comprehensive range. What I call it dynamic, functional, invisible filler, which I call it smart filler, because we are living in the new world, it's an AI world. So take home message would be think about the mild-modulatory effect when injecting fillers. Using smart fillers, not everyone needs fillers, and not every issues can be solved by fillers. Inject fillers before toxin, because the mild-modulatory effect. Go back to your anatomy, learn how to ingest safely. Learn your anatomy, your facial anatomy, vascular anatomy superficially, and also using this advanced technique. This is a future technique combining AR, actual reality, and VR, virtual reality. So you use these glass, look at the patient, there's a VR and AR. You can map the vessel on patient's face. So when you in the future, you wear this glass, you inject, you can avoid injecting into the vessel. You use the Doppler ultrasound that map out the vessel, put in the computer, put in the program, combining AR and VR together, and then you inject. This is the future. The future is now, not tomorrow. It's happening in the whole wide world. Thank you.
Xin cảm ơn Dr. Winson Hồ. Bài báo cáo rất hay về filler, những quan niệm mới về cách dùng filler, mà có tác dụng như là botulinum toxin, dùng filler trên những cái điểm quan trọng để tác động vào những cái thay đổi rất là có ý nghĩa của khuôn mặt. Thank you very much, Dr. Winson Ho, for your new concept.